Antoinette, the penis also kind of carry this kind of bacteria. I mean, men pee, and then some. They don't. For them, they don't even clean. So obviously, there's bacteria and the dirt and all those things, and then they come and have sex with you. I didn't know whether introducing, germs and bacteria into your vagina. So yeah, for some time now, I've been experiencing this itchiness down there, and it's so uncomfortable. But then sometimes I feel so ashamed and embarrassed to actually talk about it to anybody.
I see. Also, I've been hiding little secrets from you. I've also been experiencing this whitish, like sticky. It smells so bad on my panty and then abnormal pain too. But I can't tell anyone because I feel they're going to laugh at me.
I heard you, my beautiful ladies. Well, today that's the topic for discussion. We are having a powerful session with our adolescents and our fan club members. Today is going to be girls talk. Yay! Okay, so let me go briefly let you understand what the vagina is. So the vagina is the intelligent part of the female reproductive organ. And the vagina is the space between the vulva, what we see with our naked eyes, and the cervix, that's the mouth of the uterus. So that hollow space is called the vagina. The vagina is very intelligent to the extent that it doesn't need you to wash it. It cleanses itself. It doesn't need any soap, any douching, any cream, any powder, nothing to make it clean. It does itself by its own natural mechanism. In the body, we have something called normal flora. The work of the normal flora is to cleanse the body. So parts of the body that holds or have the normal flora, the vagina is part. And our mouth too, we have normal flora. So anything that enters the vagina without the rightful permission by the vagina, the normal flora acts as a barrier and cleanses it away. So immediately you put soaps and other things inside your vagina, it changes the pH or the mechanism of the normal flora. So now the work that the normal flora needs to do, it can't do it again. Our sister says something about itchy, and I heard my sister Serera also saying something about discharge. Yes. Now let us look at the normal changes or mechanism of the vagina. The things that when we see, it is normal, and the things that when we see, it is not normal. So talking about the discharges that our sister just mentioned. The normal discharge is white. Sometimes it's white but not too whitish. Then let us look at the texture. The normal vaginal texture, it is watery. Not too thick, not too watery like a normal water, but it is a little bit slimy and a little bit watery that it can slip off. The other two, with the normal vagina, it doesn't smell. It has its own peculiar smell. It's a little bit fishy, not that offensive, but let us understand and take note that every individual is different. So the way my vagina will smell will be different from the way your vagina will smell. But it shouldn't be offensive. It shouldn't have any bad odor. During our normal ovulation, menstruation period, before ovulation, the vaginal discharge becomes a little bit thicker and sticky, but not offensive. Then just immediately after ovulation, your menses comes and it ends. It becomes a little bit slimy. Like you see the way the egg white is slimy, that is the texture it becomes. But that one too, it is not offensive. The amount varies per the individual. So when you get the vaginal discharges, the amount varies. So some have a little minimal amount, some to be a little bit bigger or more. But the quantity is not too much that can be quantified. And that should cause an alarm. Now, let us look at those that are not normal, so the abnormal vaginal discharge. With that one, the smell is very offensive, like a rotten egg or something that is really spoiled. The color, greenish, yellowish, thick, browny, it is very, very uncomfortable. And when it comes about itching, it's really itchy, as our sister said. You'll be feeling the itchy more during the night period and during the day. So you always feel itchy, and sometimes you're not careful, you can scratch and get even sores. Then the discharge too is more, and it's very offensive because one, the color has changed. All these signs or all these symptoms, when it's seen in your panties or in your vagina, then we can determine and say you are having either a yeast infection, vaginal infection, trichomoniasis, or any STIs. So you need to go to the hospital. Let us look at the things you should do to get a normal vaginal discharge and the things you are not supposed to do. So just wash the outside, that's the vulva that we see, with only clean and pure water. I say clean and what? Pure water. I'm not talking about pure water we take and drink, but the water should be neat and clean.
Yes.
Then we should make sure we do it frequently and use our hands inside our vagina, because the normal flora does all the work for us. We should wear cotton panties and underwear. If your parents can support and afford, you can get a panty liner, because most of the times when we women go out to urinate, because we're in a hurry to do our activities, droplets of the urine falls in our panty, and that one, because of the heat and the moist, can create a yeast infection. So you can get a panty liner inside your panty. Things that when you do, you can get vaginal discharges that are offensive and that causes infection, or that are prone by infection, is frequently putting your hands in your vagina, putting creams and soaps and things, douching and all those things. We're not spoiling anybody's work, but it is not safe for the vagina. Because the normal flora there, when the pH changes, when the pH changes from 5 to 7, that is the normal pH of the vagina. When immediately it changes, it causes alarm and it causes harm to the human body. I think you wanted to ask a question. Yes. So let me hear you, my dear.
I wanted to know if it's normal to experience this discharge every day.
Yes, it is normal. In a healthy, normal human being, you can have discharges depending on the quantity and the texture of the discharge. So if normal flora is working and there are certain foreign bacteria and the normal flora wants to clear it off, it will come. So you see that in your panty. So it is normal when you are healthy and there is no sickness. So when the quantity is something scanty, you wee and you've seen that there are little discharges, it is normal. It's not because of any sickness. Do you have any question for me before we continue?
So I heard you were talking about inserting the finger in the vagina, like in the form of fingering.
Yeah.
So is it good for a man to insert his hand in a lady's vagina?
Thank you, my darling. No, it is not good. Because the hands that a man is inserting, how clean is the hand? If the nails are long, there are infections, there are dirt and all those things, it will enter straight to your vagina. And when there are more infections in the vagina, it penetrates and goes to the cervix, that's the mouth of the uterus, and it enters the uterus. It can lead to so many complications. Putting garlic, putting gloves, putting anything apart from just normal water is what the vagina needs. So those of us who have been using their tongue in the vagina, see the things they are introducing to us. Those of us putting garlics, gloves, and things to tighten up the place. Look at the infections they're introducing to us. They are changing the pH of the vagina. So we need not to put anything apart from clean and pure water.
Auntie Nurse, please, is it safe? Are you trying to say we can use the soap to clean the skin of the vagina? Or is just the inside we are not supposed to use soap? You understand the question?
Yes, I get it, my dear.
Well, you see, when you are bathing, you can bath
that place, maybe you shave, you want to, yes, so you can use the sponge to just bath the majora, that's the top part of our vagina, but not inside. My son, you're also asking something. Let me hear your question.
So I'm asking that between the penis and then the dildo, the electric dildo, which one is more safer?
Good. As an adolescent, ABC is what we are preaching. So you see, you are not supposed to take anything inside the vulva or the vagina. The vagina, apart from the penis, see the way the Lord has made the penis has its own skin and its own structure. So immediately it enters a woman, you're not supposed to get cracks, you're not supposed to get sores there. But these sex toys and the things you are mentioning that people are telling you, when you plug and it enters, it is a rubber thing. So it is going to cause irritation there, change even the pH. We don't know how it is prepared. So you're not supposed to put anything there.
Something else. The penis also kind of carry this kind of bacteria. I mean, men pee and then they don't even clean. So obviously there's bacteria and the dirt and all those things, and then they come and have sex with you. I didn't know whether introducing, germs and bacteria into your vagina.
So today when we go out, we those who are married among us, And we those who think you are so sexually active, you can't stay without sex, let your partner clean the pennies before they have sex. You should bath, you should clean yourself before you have sex. So that you don't change what? The pH of the vagina.
So, madam, as I'm experiencing this white discharge and then it smells so bad, what am I supposed to do to make the smell go and then the discharge go?
Thank you so much, my dear. So now what you need to do is that run to the hospital as soon as possible. Go and see your adolescent corner advocates or coordinators, because at Ga-East Municipal Hospital, where I practice the adolescent corner, we also use the syndromic approach to treat STIs. So go to the hospital, the doctors are there, the nurses are there, the midwives are there. We will give you the right treatment to use. That will help you and save you from all these infections you are experiencing. So now let me show you or educate you on how to clean and make your vagina very healthy. So the first thing is you should just wash the labia majora, only the visible parts. So when you are bathing, as our sister rightly said, you can use the sponge and the soap to wash the outer part, not the inside. And then we shouldn't be inserting our hands inside the vagina. When we are using the toilet, we want to poo. Afterwards, don't clean from back to front, but rather you should clean from front to back. Then when you wash your vagina and you want to clean, just part the labia majora. Don't clean inside because the inside is already moist because of the normal flora there. Then we should just clean with clean water and warm water and save water as such. So unscented soap that we used to bath, that is what we can use to clean the majora. That's the topmost part. This is the safe and the simplest method that we can keep our vagina healthy.
Auntie Ness, a friend of mine too was experiencing this vaginal discharge we keep talking about. But she went to the pharmacy and the medication they gave her, it kept getting worse. So please, what can I do to help her?
Okay. Thank you so much. So tell that friend to stop using that medication as soon as possible. Any medication you don't know how it was prepared, it is not safe for the body. That friend should run and come to the hospital. Present the symptoms that she's experiencing. The doctors and midwives are there to help her solve that infection that she's experiencing.
So, madam, please, I want to ask, how will you know when a girl child at the age of 15, 16 is also experiencing this discharge? What are the signs that you get to know that she is experiencing or he is also experiencing a discharge as such?
Okay, thank you so much. So I'll go back, as I said earlier on, and talk about the normal and the ones that are not normal. So with the normal vaginal discharge, the color is clear, white, and slightly cream. Yellowish when it dries in our underwear. The smell too is mild and not unpleasant. Every girl has his or her own normal smell. The texture of the vaginal discharge is watery, stretchy like egg white or slightly thick. Changes throughout the month. The amount varies. More around ovulation, less at other times. All of this is normal. Then the pain, there is no pain. Normal discharge does not hurt. So when we want to talk about the abnormal discharge, the color is yellow, green, gray, or fruity. Then you can possibly say the person is having bacterial vaginosis or trichinosomiasis, which is an STI. Then with the smell, it is fishy salt, rotten, or very strong smell. With the itchy and the burning, inside and outside constantly. So the person will feel always itchy instantly at the outside, that's the labia majora, and inside the vagina, the minora, and inside, all will itch that person. And it's normal, the itching normally worsens at night. Then it is painful during urinating and then sex. And normal daily basis, the person normally feels pains. When you talk about the texture, it is thick, white like cottage cheesy texture, and it sometimes forms. It's a foamy thing that you can pick, cook. We say agushi. That thing, yes, that is how the texture also is felt or seen. All these things are possible causes of what? Vagina or yeast infection. So when you experience all these things, do not stay in the house. Rush and go to the hospital for immediate medical care.
I have this cousin. She experiences this vaginal discharge every time after her menses. But her mom always tells her to sit on warm water with prekese and huntia. Is it safe or she should stop the practice? And it's also itchy.
Okay. Thank you so much. As we just rightly discussed, what should enter the vagina? Let us all say clean water and warm water. So apart from this one, that is the safe water, nothing should enter the vagina. So sitting on prekese or anything to make the place becomes, yes, the natural method also sometimes work, but the normal flora has its own pH. So immediately you put in something that will alter the pH of the vagina, it causes an infection. So tell your sister or that cousin that, yes, after normal vaginal period or menses, it is normal to have discharges. It is normal because now the uterus contracted and relaxes for all the menses and everything that needs to come out came out. So it is normal. But the minute it becomes itchy, too much itchy, with smelly discharges, the color changes, you need to seek extra care from the hospital. Well, my viewers, if you're now joining or tuning into the Adolescent Corner channel, this is your Adolescent Corner coordinator, Abigail Ansah Asamoah from the Ga-East Municipal Hospital at the Adolescent Corner unit. Today, we've discussed an interesting topic that I want you to share this video on vaginal hygiene and personal hygiene among women. Bring your questions, anything bothering your adolescent, anything bothering you as an adolescent, bring it out and we'll be there to give you the possible answers as soon as possible. Let us stay safe and speak to a friend. Tell a friend to tell a friend that the vagina has its own pH. We need not to alter it. See you. Do well to like, share, and subscribe down below. Bye.
Bye.